So today we are going to learn about hypertension. What is hypertension? Hypertension is a elevated blood pressure. But how much? According to the American College of Cardiology or American Heart Association, normal systolic is less than 120 and diastolic is less than 80. Elevated BP. Systolic is 120 to 129 whereas diastolic is less than 80. Hypertension stage 1. Systolic is 130 to 139 whereas diastolic is 80 to 89. Hypertension stage 2. Systolic is greater or equal to 140 whereas diastolic is greater than equal to 90. The 8th Journal National Committee JNC 8. Normal less than 120 and less than 80. Pre-hypertension 120 to 139 or 80 to 89. Hypertension stage 1 140 to 159 or 90 to 99. Hypertension stage 2 greater or equal to 160 or greater or equal to 100. Prognostic significance of systolic BP and diastolic BP is age dependent. That is, age greater than 50, systolic BP is more important, whereas age less than 50, diastolic BP is more important. Let's get familiar with some terms. Isolated systolic hypertension. The systolic is greater or equal to 130 and diastolic is less than 80. Isolated diastolic hypertension. Systolic is less than 130 whereas diastolic is greater than equal to 80. Mixed hypertension. Systolic is greater or equal to 130 and diastolic is greater than equal to 80. White coat hypertension, also known as isolated office hypertension. It's a transient elevation in BP when performed by the doctors. Marked hypertension, an elevated BP out of the clinic, ambulatory daytime BP or home BP. Both white coat hypertension and marked hypertension doesn't meet the criteria for hypertension. Accelerated hypertension, also known as malignant hypertension. It is a rapid and sudden rise in BP over the baseline level. If untreated, damage to organs and tissues like hypertensive retinopathy, kidneys dysfunction, especially proteinuria, hypertensive encephalopathy, and left ventricular failure. Refractory hypertension refers to the situation where the multiple drug treatment do not give adequate control of BP. I am sure that you have heard about hypertensive crisis. So what it is? Systolic by diastolic is greater than 180 by greater than 120. Severe hypertension plus no damage to end organ is the hypertensive urgency, whereas severe hypertension plus damage to end organs is hypertensive emergency. What are the types of hypertension? Primary hypertension, also known as essential hypertension or idiopathic hypertension. Although the exact etiology of primary hypertension remains unclear, a number of risk factors are strongly and independently associated with its development, including age. Advancing age is associated with increased blood pressure, particularly systolic BP, and an increased incidence of hypertension. Obesity. Family history. Hypertension is approximately twice as common in subjects who have one or two hypertensive parents. Race. Associated with greater target organ damage in black patients. Reduced nephron number. Reduced adult nephron mass may predispose to hypertension, which may be related to genetic factors, intrauterine development disturbance like hypoxia, drugs, nutritional deficiency, and premature birth and postnatal environment like malnutrition, infections. High sodium diet. Excess sodium intake Example, greater than 3 grams per day increases the risk for hypertension. Excess alcohol intake is associated with the development of hypertension. Physical inactivity like sedentary lifestyle is also a risk factor. So the exercises like aerobic, dynamic resistance and isometric resistance is an effective means of lowering blood pressure. Let's talk about secondary hypertension. It develops secondary to some well-defined clinical pathological conditions like renal causes, acute glomerulonephritis, chronic renal disease, polycystic disease, renal artery stenosis, renal vasculitis, renin-producing tumor. Endocrine causes, Cushing syndrome, primary aldosteronism, congenital adrenal hyperplasia, pheochromocytoma. Thyroid disorders like hypothyroidism, that is maxilledema, it increases diastolic BP, whereas hyperthyroidism, that is thyrotoxicosis, increases systolic BP. Pituitary cause like acromegaly, where excess growth hormone is released. Pregnancy-induced hypertension, which is also known as preeclampsia. Cardiovascular causes, coarctation of aorta, which causes ischemia to kidney, which response increases renin synthesis, in response increases RAS system, renin, angiotensin, aldosterone system. Another cause is polyarthritis nodosa, rigidity of aorta. Neurological causes like psychogenic, increased intracranial pressure, sleep apnea, acute stress including surgery. In stress, catecholamines is released which increases BP. As we know, any mental illness lead to high BP. Lastly, let's learn about complication. Some neurovascular complications are cerebral ischemia, cerebral hemorrhage, transient ischemic attack. Ophthalmic complications are retinal hemorrhage and papilloedema. Cardiovascular causes are heart failure, left ventricular hypertrophy, angina and myocardial infarction, arrhythmia. And some renal causes are nephrosclerosis and chronic renal failure.